Assalamu alaikum jami'an, and good evening, Dr. Farhad. It is a pleasure to have you with us today on this first episode of Serious Ask a Doctor. So we are all here honored to have Dr. Farhad Janahi. He is a consultant urologist and also an assistant professor, and he works now in Mediclinic, Medicity in Dubai, right? And he's here to answer your questions and concern regarding prostate cancer. So I'm here to welcome you on behalf of all our followers in Instagram. So how are you doing, Doctor?
Good, thank you. First of all, thank you very much, Dr.Lamees, for having me. And I think this is a great program to raise awareness about prostate cancer. As you know, September is the month for prostate awareness and prostate disease awareness. So thank you very much for this initiative.
It's really a pleasure to have you with us today. So I think we can start with asking the questions that we had from the audience. And many of the audience actually wanted to know about what are the main signs of symptoms that they have to look for that is suggestive of prostate cancer.
Okay, so first of all, prostate cancer is extremely uncommon in men below age of 50. Okay. And unfortunately, prostate cancer, like many cancers, there are no signs and symptoms unless it's late stage disease. So usually there are no signs and symptoms. Sometimes a person, a man above age of 50, they can have some urinary symptoms, like in terms of passing urine, frequency, or waking up at night to go to toilet, or sometimes they may have urgency, or sometimes they may have burning symptoms. So if they have any of these signs and they are above the age of 50, then they should consult their doctors. If a person has late stage cancer, prostate cancer, they can have back pain. So prostate cancer, unfortunately, can spread. And one of the commonest places to spread is the back, the spine. And usually they complain of back pain.
Great, thank you, doctor. I also know that actually, if we are able to spot the prostate cancer in early stages, then it has a high cure rate, isn't that right? So my next question, and I got that from many men actually, that in order to spot it early, because there is no signs and symptoms, so what kind of tests they can do, and at what age they can start doing it, and for how often, like that they need to do that kind of screening test?
So for prostate cancer, we have guidelines from the American Urological Association and European Association recommended to do recommended to go to visit their urologist or their family doctor, and at age of 50. Okay, and the doctor then will do some tests, and one test is called PSA, prostate specific antigen. Unless that person, that man, has a first degree relative who had prostate cancer. In that case, they need to do this test at age of 45. This test should be repeated once a year with a consultation with a urologist or their family doctor who has a special interest in men's health.
Great, thank you, doctor. Also, I want to ask you, let's say there is somebody who is actually under the age of 50, however, they do have some of the signs and symptoms you've mentioned. So they might have some urinary difficulty, or they're frequently going to the toilet, or they might even have an erectile dysfunction. So, but they're under the age of 50. Would you advise them again to go and visit the doctor in that case?
Yes, so in that case, they need to see a urologist, or again, a family doctor who has a special interest in mental health. So it could be, other diseases such as urinary tract infection, such as benign prostatic hypertrophy or hyperplasia, basically the enlargement of the prostate, which can cause those symptoms such as frequency in urination, difficulty in urination. So definitely they need to they need to visit the doctor. I said that they should visit at age of 50 if they are asymptomatic. But if they're symptomatic at any age, they should seek advice from their doctors.
Excellent. Thank you. Thank you. That's really good information to know. And so I got a few questions as well. It's related probably who has the higher risk. So you said that family history or having a member who had some sort of a prostate cancer disease or any kind of cancer history, that they need to be alarmed for that. But is there any risk factors that we need to consider? Because I had a few questions from people asking, is having a kidney disease a risk factor by itself, or having erectile dysfunction also a risk factor?
Having a kidney disease is not a risk factor for prostate cancer. Erectile dysfunction could be a sign for prostate cancer. So if they have any of these symptoms, erectile dysfunction or any urinary symptoms, they need to seek advice. Prostate disease in general, okay, in this session we're talking about prostate cancer. Usually we divide the prostate disease into 3 categories. Prostatitis, inflammation of the prostate, the hub prostate, okay, that can happen in younger age, usually in 20s, okay, and that can cause going to toilet infrequently, they're having burning sensation. So that's one that can happen in early age, in younger age men, okay. Then we have hypertrophy of prostate, the enlargement of the prostate, تضخم prostate, okay? That usually happens after age of 45, okay? And that can cause, again, similar symptoms. And then we have the prostate cancer, which we are talking today. Usually that's very rare to get below age of 50. So if they have any of the symptoms, if they have any urinary symptoms, they have to see the doctor.
Excellent, great. And actually, I do have a question myself. When it comes to prostate disease, as you said, there are several ones, and one of them is prostatic hypertrophy. And it is something that is quite common, especially as a person grows older. So if somebody is suffering actually from prostatic hypertrophy, would you advise them just to do a surgery to remove the prostate? Is it advisable? And if so, would that affect their, cause any erectile dysfunction, or will affect their libido or anything like that?
So if they have enlargement, it depends on the degree of the obstruction. So if a prostate, as you know, urine passes through the prostate. So if they have enlargement, that passage is going to be narrower and it's going to cause urinary symptoms. So in those cases, we can give them medication. Sometimes we may do surgery, or we have different technology to deal with that. Hopefully, another session we talk about benign disease, which is not a cancer, and we talk about different, treatment modality.
Great.
So for cancer, you ask for what are the risk factors. So the risk factor, like any other cancer, so smoking is a risk factor. You have to be healthy. Obesity is shown it could be a risk factor. Another risk factor that many people may not know is if they have a young female sibling, a sister, that had breast cancer, okay, with the gene, this BRCA, there is a link that the men in that family should be screened very closely. And those people may not have a high PSA. So that's another risk factor. They have a man that has a sister who had aggressive and higher stage breast cancer at a younger age. The men on that family should be screened at the age of 45, even if they don't have a male person that had cancer in the family.
That's quite interesting, doctor, because a lot of people, they might not get this. So it's good to know about that. And actually, you've said that there are kind of different types of prostate cancers. There's the aggressive ones as well, and there's the non-aggressive ones. How common are each? And is there any signs that we can detect, or it has to be done through lab discoveries?
Okay, so prostate cancer, after someone is diagnosed, we divide them into three categories: the low risk, intermediate, and high risk. Okay, low risk cancer, usually we treat them conservatively. Intermediate and high risk, yes, we go for interventions such as surgery or radiotherapy. Prostate cancer is quite common. You know, the higher the age, the higher risk of cancer. So if you take a 80-year-old man, most likely that person will have cancer. But do we need to know? Does he need to know? Or do we need to treat them? Maybe not. So our job as urologists is to detect those aggressive cancer and treat them. Some patients have many patients who have prostate cancer, but they are under surveillance. So they have a low risk prostate cancer. We do not treat them, but we watch them. If the cancer is progressing, then we give them treatment because, you know, if we do any treatment for prostate cancer, it has a lot of side effects. No matter how they do it, surgery or radiotherapy, they can have side effects of urinary incontinence or erectile dysfunctions. For that reason, our aim is to pick up those patients who have aggressive prostate cancer, who can treat them and prevent them getting into higher stage and spread of the disease.
Great, great. Thank you, doctor. And actually, I got a very interesting question. It was one of my colleagues. She's a doctor as well. And she said that she read in one of the articles, probably it's not a new one, maybe an older one, that when they did autopsy to men, there was 80% of them actually did have some sort of prostatic cancer at elderly age. So my question to you is, how common is that? And is this actually true?
That's absolutely true. There are several studies that show that people, when they did autopsy, even at the age of 20s and 30s, they had prostate cancer.
Wow.
Okay, so there are people who have indolent prostate cancer, and you know, we don't need to know. They don't need to know. Okay, so sometimes we give diagnosis of prostate cancer and I say, doctor, what you gonna do? I said, nothing. We're just gonna watch you. But that person will go and start thinking, cannot sleep at night. So yeah, prostate cancer is quite common. If you look more for it, we're gonna find more. So our duty is to find those who have aggressive cancer. Yeah, yes. As I said, if you go age of 80, you biopsy people, 80% of 80 years old have prostate cancer. 70% of the 70 years old will have prostate cancer. But wow. Do we need to know? Do they need to know? No.
No. Great. And that's also lead me to another question is about the screening test, as you said, the PSA. So you have mentioned that this test may not be elevated in someone who might have a female history in their family with breast disease. However, let's say at the regular cases, when we are expecting a rise in the PSA, how specific and how accurate it is to pick up the disease? And is there other tests that are reliable or used for screening?
So for screening of prostate cancer, really we have two tests. One is the blood test, PSA, which is not that sensitive, okay, but it's good for screening. I mean, if someone PSA is normal, and we don't talk about normal PSA, basically we have some cutoff for different ages. So usually we say for a man, you know, below age of 60, it should be below 4, okay? So if someone comes and PSA is 3, has no risk factor, we will not proceed with anything. But if someone comes with a PSA of 5 and we repeat that test, because it can cause false positive, such as if that person has urinary tract infection, or they had ejaculation before the test, the night before the test, PSA can be high for those reasons. So we always say we don't go with one test. If someone comes to me with a rise PSA, I can come back in 6 weeks to 2 months time and we do another PSA. If that is high, then we go to the next stage. So the two tests for screening we had was PSA and digital rectal examination, which all men here, okay? Yes. And that's why they don't want to come and see us. Digital rectal examination, again, it's very subjective, okay? You go to a different urologist, they have a different opinion, okay? Now what we do is we do PSA. If the PSA is high, we do MRI, a specific MRI called multiparametric MRI, and that will give us a very good indication. So in the past, when I was a trainee, we used to do DRE, digital rectal examination, and a PSA, and any of them was positive, then we go for transrectal biopsy, which is again not a nice experience for men, going through the rectum and taking biopsies. Now the guideline has changed. We do PSA. We repeat it again if it was high the first time. Then we go to the second one. If it's still high, we do MRI. So really, we don't invade men as they feel, especially in this environment, in this culture. People don't like to have this digital rectal examination.
Yes, I think that's a good news, Dr. Farhad. People be delighted to know that there is options. So actually, that's the questions that I got from the audience. And I would like to know from you a last advice that you want to advise men and around there. And also, you told me that this awareness is not for men also. Women need to be aware of that. So if you want to elaborate on this, and thank you.
My experience here, especially in the UAE, men usually don't like to come to see a doctor, you know, whereas women, they look after themselves much more. They go, such as breast screening. Men usually don't like to come unless they are forced to. So majority of the patients that I see, they come through their spouse. So that's very important. I think this session is, I think more women will watch it than men. Yes. And the woman will go and convey the message to the men in the family. So yeah, absolutely. So the daughters, they bring the father, or the wife bring the husband. So this is a little bit different than in Europe. So I think this program will be much more useful for women than men.
I'm really happy actually to be part of this. And Doctor, I want to tell you that I noticed that there's not much awareness, or let's say not much enough awareness about men's disease in general, and maybe prostate cancer specifically. So I think this is a great opportunity to have you, our expert, to talk with us today and to answer our audience questions. It's really a pleasure to have you, and we'd like to have you also in future sessions as well.
Inshallah. Thank you very much, Dr. Lamees. Thank you for this initiative. Prostate cancer, unfortunately, yes, you know, people, not many men, they know in this country. As you know, for breast cancer, we have Pink Caravan. There are a lot of awareness campaign, but when it comes to men cancer, unfortunately, we don't have that many. So hopefully a program such as this will raise the awareness about prostate cancer and men cancer.
Inshallah. Thank you. Thank you very much for your time. And it was a pleasure again. And hopefully we'll see you soon.
Thank you.
Thank you.